Heidi Regency, and welcome to the HR Show. This week, our special topic is about a young girl who started suffering from epilepsy at only 3 months old. She visited the hospital on countless occasions but continued to deteriorate. In 2012, this beautiful girl died at age 30. At this time, I would like to welcome Leah's doctors, Neil, Ernest, and Peggy Phillip, and resident Dan Murphy to the show.
Thank you, Heidi, for having us today. We're so happy to be here.
Today I want to talk about Leah's condition, your actions, and what went wrong. Who met Leah first?
That would be me. I was a resident on duty when Leah came into the ER for the third time. She was in the middle of a seizure, and she was the youngest patient I'd ever seen seizing.
Did you know at this point that it was epilepsy?
Because she was seizing, I thought that was a good assumption, but I performed a spinal tap to be sure that there wasn't any other infections going on. However, while she was in the ER, she seized again, and at that point I diagnosed epilepsy. I was having a hard time communicating with her parents due to the language barrier. There was no way for me to explain I thought it was epilepsy and where the electrochemical storm was coming from. I couldn't find the source.
So Peggy, you had contact with Leah as a consult requested by Dr. Murphy. Is this correct?
Yes, at the time, Leah was only 8 months old. I noted Leah probably had benign focal seizures of infancy, and staying on Dilatin therapy would work to suppress her grand mal seizures.
I admitted Leah since she was having multiple seizures and needed to be monitored.
So what other medications did you prescribe Leah?
I later added phenobarbital, and lastly, a consulting neurologist added Tegretol. Both Dilatin and phenobarbital are anticonvulsant medications.
And Leah was receiving all of these.
The parents always seemed to understand what we were telling them. When an English-speaking friend or relative could translate, we could only assume that her parents were able to follow along with the medical plan we had for Leah. We don't speak the same language.
It had not occurred to us that Leah would not get the right medications. Her parents decided that they didn't like the Tegretol or the Dilatin, so they just gave her the phenobarbital. But also, they were doubling up the dosage, effectively giving her an overdose on multiple occasions.
So did the change in medication have any effect on Leah? What did any lab tests show?
They showed that there were subtherapeutic levels of phenobarbital in her system, and that was the indicator to me that something in her prescribed medical plan wasn't going right. She came into the hospital again seizing. This time I made the mistake of giving her too much anticonvulsant, and I had to intubate her.
So what did the parents have to say about this? Do you blame the parents for Leah's worsening condition over the time that she was under your care?
I couldn't explain to them what was going on. The Hmong don't have the same concept of the body that we do. Organs aren't part of their view of who a person is. How can I explain that I have to put a tube through her throat into her lungs to help her breathe when they don't even know what her lungs are?
Yeah, it's hard to blame only the parents without blaming ourselves as well. It was obvious that the lack of medication was contributing to her condition, but we did not know what was going on at home. I never visited, and Peggy was briefly there once.
So you believe only the medications would heal this little girl. Was a different course of treatment ever considered? And what about the parents? Since they weren't giving her the medications, was there anything they were doing at home that could have worked to help Leah?
Her medications should have been able to work and keep away, or at least lessen, the seizures. The medicine in practice is sound. Our professional training tells us that the problem is not cultural, that it is not religiously related, but medical. The electrochemical storm in Leah's brain was causing more and more damage each time. We are all trained physicians who only wanted the best for Leah.
So it was the seizures that finally killed her.
Turns out she didn't have her final seizure due to epilepsy, but actually as a result of being septic.
Had you not identified sepsis during any of her previous admissions?
Well, Leah's last admission at MCMC was during the throes of a bout of status epilepticus, which even for a short period of time is life-threatening. But Leah seized for almost 2 hours. Sepsis wasn't on my mind.
So where were the parents during this episode?
They were waiting in the hallway. The extent of the procedures we were putting Leah through would have been a lot for the parents to handle. They already didn't like our medications. We were cutting holes in their daughter's leg in order to start an IV and sitting on top of her to hold her still during the seizures. Not only are the seizures traumatic, but our actions as well.
Not only are the parents from a different culture and don't speak the same language, but they were also left out of the care for their child.
When a major case comes into the ER, our only concern is getting the patient stable. In Leah's case, stopping the seizure before it could cause irreparable damage.
The Hmong are from such a contrasting culture that it's hard to treat these patients the same way as everyone else. we cannot communicate with them. We have different concepts of the body and we have different ideas on the proper course of treatment.
So you were all there during the seizure.
I was the only one present. Leah was stable when she left us. I had her transferred to Valley Children's Medical Center because they were better equipped to handle pediatric critical patients. It was on the way to the hospital that she experienced a seizure that left her brain dead.
So what steps do you take now? Was there something more you could have accomplished during her earlier stages of treatment?
There's plenty of information in her chart that could have been an indicator, but piecing together information that multiple people have written down is really hard. Once we heard that her final seizure at Valley was due to septic shock, we went back through all of our files to see what we missed and when.
Certainly there was more. There's always more. Paid more attention to the parents, paid more attention to Leah's medical results, more treatment, different treatment. We could have tried to communicate better with the parents. There's hindsight in every case, but at that moment, you can only go with your best judgment.
So what would you consider the biggest problem to be? Obviously there was a language barrier.
Lack of communication is a large problem. We are not the only physicians to fill this burden, as there is a large Hmong population that comes to this hospital. Because of the language barrier, the parents weren't able to understand what we were putting their daughter through.
Did the parents ever try to communicate with you?
No, any complaints or worries would have been expressed in their language. It's obvious now that even if they tried, we wouldn't be able to understand each other. Thinking back, the parents changing Leah's medications without consulting us is an indicator that there were problems and concerns. They were just never explicitly expressed.
So future cases, what will you do differently?
We still only have the medicine. That is our language. However, becoming more aware of the background of our patients will give us a better idea of what kind of treatment plan will work. But a treatment plan is not just the medicine. It includes communication, trust, and respect, and compliance by the patients and all other parties that are involved in care.
Personally, I've developed great interest in the Hmong, their culture, and their ways of life. This information is critical to how we will treat these patients in the future.
All right, thank you Neil, Peggy, and Dan for joining me here today. It was an honor to hear your side of this tragic story. That's all for today on the HR Show. Until next time.